Good afternoon. My name is Sarah. I'm from the Jewish Home in Freehold, New Jersey. I just wanted to introduce our Director of Infectious Disease, the famous Dr. Henry Redel from St. Peter's University Hospital. Dr. Redel is here to speak to everybody about the new BAM treatment that we are currently doing at the Jewish Home, give you a little bit of background about it and its effectiveness, what we can and can't do. So without further ado, I'm going to turn it over to Dr. Redel.
So thank you for the kind introduction, Sarah. Today we wanted to talk to you a little bit about bamlanivimab, which most people can't pronounce, and I'm surprised I got it right on the first shot. It is a monoclonal antibody treatment that is approved by the FDA for emergency use authorization in outpatients with coronavirus. Its effectiveness in preventing hospitalization probably lowers the risk by about 60% of going to the ER for coronavirus related symptoms if administered in the appropriate population within 10 days of the onset of symptoms. This may apply to some patients who are being discharged from the inpatient setting who didn't come in with coronavirus symptoms. If they had come in with coronavirus symptoms, then this may not apply to them. But if they did not and came in for another cause and were subsequently diagnosed with coronavirus, if they meet the criteria specified by the EUA, which is either a BMI over 35, CKD, diabetes, immunosuppression, currently on any immunosuppressive treatment, or over age 65, or age 55 plus cardiovascular disease or hypertension or COPD, and they're going to be discharged to a rehab facility, the Jewish Home is able to infuse them with bamlanivimab to help decrease their chance of getting severe COVID or being hospitalized with coronavirus. So I think this is a great treatment that we're able to offer to the patients who meet this criteria. And we have had a few patients that I've seen hospitalized who unfortunately didn't meet the criteria, were incidentally diagnosed or got nosocomial disease. If you're able to get them to a rehab within 10 days of that, Jewish Home would be able to infuse them with bamlanivimab, and which would be a beneficial treatment to them.
So just to clarify, Dr. Redel, if a patient is in the hospital for a different diagnosis, say cellulitis, and during that duration, that patient is swab positive, as long as it's within 10 days, he can come over to us and we can initiate the BAM treatment here.
Correct.
Okay.
If they meet the criteria that we discussed, yeah.
Are there any side effects or any, obviously it's monitored by an RN. It's infused with the supervision of an RN and watched thereafter with an RN.
Yeah, there's I haven't seen many side effects of it, but certainly infusion reactions are possible with any infusion, allergic reactions, but they'll be monitored with an RN, as Sarah had mentioned. And these are some of the treatments that have been used and shown benefit in clinical trials. So anything we can do to avoid potential hospitalizations is useful. And so I think the monoclonals are a great supplement to unvaccinated or even vaccinated patients who develop subsequent disease.
Right, so our experience here at the Jewish Home, we've had quite a few patients from various group homes or assisted livings where they had gone to urgent cares, got that positive result, came to us straight from the urgent care. We've had great success and they've subsequently been discharged from the rehab center. We do have to have the order in a timely fashion by the physician in order to get it from the pharmacy. So, the primary care physician here in the facility would be filling out the 2-page form that they are clinically and they meet the criteria. And obviously the family has to give a consent for the treatment. then we'll fax that form over to the pharmacy. And if it's done by 8 a.m., we can get it same day. If not, it would be the next day. So depending on when the patient's ready for discharge from the hospital or when they are admitted from the community, we'd obviously try to get the treatment in as fast as we possibly can. It's obviously more challenging on a weekend, so we do prefer Monday through Friday admissions for the BAM treatment. Anything else, Dr. Redel, that I haven't covered or that you'd like to say about COVID? And you can even go on to the vaccine if you'd like.
Yeah, I mean, I think people, as we can get vaccinated, that's going to help us get past this and get on with life as we knew it, or some semblance of what we were used to. So I'd advocate for that, and any treatments we can do to help save people's lives and to decrease their chance of getting hospitalized, I think are truly beneficial. And if we have patients who meet this criteria, I think we should try to infuse them and take care of them with the best of our abilities at this time.
Well, we thank you for all that you do. I think to date we have 130 plus patients that went through our doors with COVID and have been successfully discharged. Our staff has done a tremendous job during this pandemic, and I think our numbers are down to, I think we had 7 or 8 positives on our COVID unit. So obviously we're dwindling. Hopefully the trend will continue downward. And, we're here to partner with whichever hospital, whatever physicians, group homes, communities that need our services. We're just a phone call away. Myself and Raquel can be reached 7 days a week. We're available. We admit on the weekend, we admit in the evening. It's just a phone call away from us. So thanks again for trusting us with the care of your patients. And thank you, Dr. Redel. Appreciate everything you do.